This is Hope Cook with Dermcast TV. Today we have James Worry. James is a PA in Pittsburgh. He also has his PhD and he teaches at University of Pittsburgh. So James, you're going to talk to us today about pregnant women with rashes.
That's right, Hope. Thank you for having me today.
Yeah. All right, James, pregnant women with rashes. I am going to admit, I get really nervous when I see on my schedule, pregnant woman with rash. Do you feel the same way, or do you feel like you've kind of gotten a handle on?
No, I think anytime we hear or see a pregnant woman, it like strikes fear into our hearts and makes you super nervous because there's just an immense amount of extra pressure. I think not only do we have our normal full-sized on the schedule patient, but now she's brought an additional person with her and we're responsible for that patient too. So it can be a little overwhelming.
Right, and it depends on the obstetrician, what they're going to allow the patients to use.
It does, and even when I think, okay, I've got this, I know that these things are okay, I always say to her, we're going to check with your OB doctor as well, and I think it makes her feel more confident in what you're doing, a little bit safer. It's a nice safety net and kind of backup that you've run it by someone else.
Yeah.
So I always try to take that team approach to treating a pregnant woman.
Yeah, that makes sense. What do you hope that PAs who are listening to this take away from it at the end of the talk?
Okay, so I think one is don't freak out.
Yeah.
It'll be okay. And I've tried to incorporate into the talk kind of a little charts and algorithms to help you step through this and work step by step and logically. And you just have to remember pregnant women are, first of all, patients who get normal rashes, just like anyone else, pregnant or not. And yeah, there are some kind of unusual or weird things that only occur in pregnant women, but most of them we can work through. And the team-based approach is really paramount when you're taking care of a pregnant woman.
Yeah, so you call the OB and you say, this is what I'm thinking the rash is.
I do. I typically will say to her, you know, this is what's going on. These are the things we normally do, but I'm going to run it by your OB doctor. And that actually has a couple purposes. Some are a little more self-serving than others, but one, you're checking on the patient and making sure she's safe. Yeah. You're kind of doing that safety net of two people looking after the same person. But also it allows you to be in front of another provider, and that provider may become a referral source for you in the future. So there's a little bit of patient care with it. There's a little bit of business with it. And I think overall it's good medicine.
And you'll be known as the guy who treats pregnant.
The pregnant dude, yeah. So I'll be the one. And then I'll have a waiting room full of pregnant ladies.
Exactly. Are there any rashes that we need to really look out for that you do not want to miss?
There are some really unusual or more serious rashes that can occur in less than 1% of pregnant women. So we don't see them as much, but we still have to recognize them, or at least recognize that this rash is not an everyday thing like eczema. So pregnant women can get sort of a form of pustular psoriasis, and that can result in some serious consequences for both the pregnant woman and the baby. They can have rashes that are going to start to change some of their chemistry panels or their lab work, and we run the risk of electrolyte imbalances and more serious things. So there are rashes that can be very serious and need to be recognized, because sometimes then the care becomes a lot more complex, inpatient care, or specialists who work with high-risk pregnancies. So we're kind of the gatekeeper for the rash. We have to decide, is this serious or not? Is this something we need to biopsy or not? And from there, assemble the team to help with the care. Yeah.
Yeah, it is a lot to think about when you have a patient who's growing a human.
Two patients in the same 5 minutes, block is a little bit challenging. Yeah.
That's right. And you can do biopsies on pregnant women. You can use lidocaine with epi if you...
We typically will use plain lidocaine in pregnant women, and you can certainly do punch biopsies, shave biopsies, whatever you need to do as you normally would. But typically I use just plain lidocaine in that situation.
Gotcha.
Or even you can use saline if you're slick and quick.
Make a little blend.
Yes, yeah.
Perfect. And then you can use antihistamines in general?
You can. I was kind of bummed out when the pregnancy categories went away because
Yeah.
I thought that's a really good guideline. But there are antihistamines that you can use, some of the more old school antihistamines, even diphenhydramine or Benadryl. Those things are safe. So in our lecture, we're going to touch base on, we have different broad categories of medications, antihistamines and steroids and antibiotics. And we're going to throw out some names that are safe to keep in the back of your mind.
I like that you have an algorithm and that you said don't freak out, because I think that's our first inclination, is to freak out. But if you have an algorithm, you can just go step by step, remain calm.
Right. Remain calm is the first thing. Take it all in and then kind of step back, and we can work through it, and we could see what kind of lesions are these. Are they primary lesions or not? Is this itchy or is it not? And by doing that, you can really work through what's happening.
And give her some relief.
Relief and confidence is really key. These women are nervous, and they're fearful if what they have can hurt the baby. So there are rashes that are completely inconsequential to a developing fetus. And when you know those things, and you could say to her, this is certainly uncomfortable, or this is a problem for you, but the baby's okay. I've had women say, like, as long as my baby's okay, I could care less what my skin looks like. And you give them that relief. And I think that is a tremendous help, even as much as any medicine that we give them.
I think you're right. It's that fear factor that really makes them nervous. And then when you can reassure them, then they're probably going to be a patient for life with you.
And their child, well, I'll wait 20 years for him to have acne, and it's all good for me.
Exactly. I wanted to talk a little bit about topical steroids, because I feel like some of us are nervous about using topical steroids with pregnant women, especially things like clobetasol. So do you have any generic guidelines for that?
Yeah, you can put topical steroids on women. You can even do crazy things like put moderately or stronger steroids on people's faces. It is okay if you temper it and do it correctly. We give pregnant women systemic steroids, all the time. So topical steroids are fine. You may not want to blast them with like their whole body covered in clobetasol. But, like something like clocortilone or Westcords or triamcinolones, it's perfectly fine. The systemic absorption is minimal if you're not smearing a big area. And you're going to give them relief. And that's really the most important thing, is that you help them, you give them something that's effective and makes them feel better. Because otherwise, they're going to turn to other things. They're going to do things over the counter. They're going to use somebody else's medicine. They're going to, cover themselves in apple cider vinegar. I don't know. But you know what's safe, and there's no need to be afraid of topical steroids.
Thank you for joining me today.
I'm really looking forward to it. Thank you.